Dear Explained Med followers, do you know the different specialties of doctors? If you don't, watch this video.
When unexplained symptoms strike, walking into a modern hospital corridor can be overwhelming. Knowing which expert to consult is often the first challenge. A persistent skin rash requires a different diagnostic approach than an irregular heartbeat. Medical science is divided into focused disciplines because the human body is too complex for any single practitioner to master every biological system. The hospital directory is organized by mapping these specialties to the specific anatomical domains they treat. Identifying these roles makes the hospital environment functional, helping you determine which department to visit for an evaluation. The body's exterior barrier is the first point of contact. A dermatologist focuses on diagnosing and managing conditions that affect the skin, hair, and nails. Moving inward, we find the cardiovascular system. A cardiologist evaluates the heart, managing blood pressure and identifying the causes of abnormal heart rhythms. The electrical command center is the domain of the neurologist. They specialize in the network of the brain, the spinal cord, and the peripheral nerves. Beside the heart, a pulmonologist oversees the lungs and the mechanics of the respiratory system. These initial specialists manage the systems that protect the body and maintain the vital internal processes required for survival. Below the chest, the gastroenterologist manages how the body processes fuel, diagnosing issues across the stomach, intestines, and liver. The resulting waste is handled by the body's primary filtration system. A nephrologist is dedicated to kidney function, managing electrolyte levels and fluid balance. While the nephrologist handles internal kidney function, a urologist treats the structural components of the urinary tract and the male reproductive system. Systemic regulation relies on chemical messengers called hormones. An endocrinologist treats conditions like diabetes by monitoring how the body produces and uses compounds such as insulin. This group of specialists acts as the body's chemical and metabolic management team, maintaining internal biological balance. The body's physical framework is managed by an orthopedist. They treat the musculoskeletal system, focusing on the health of bones, joints, and ligaments. Sensory input is also highly specialized. An ophthalmologist focuses on the eyes, providing medical and surgical treatment for vision-related diseases. Similarly, an ENT specialist, formerly called an otolaryngologist, manages the interconnected structures of the ear, nose, and throat, along with related conditions of the head and neck. These doctors ensure the body remains mobile and that sensory connections to the outside world stay intact. Medical care also adapts to specific stages of life. A pediatrician monitors the growth and developmental needs of infants, children, and adolescents. Women's health requires a dual specialization. An OB-GYN handles both obstetrics, the care of pregnancy and childbirth, and gynecology, the study of the female reproductive system. Clinical care also addresses mental well-being. A psychiatrist is a medical doctor who specializes in the assessment and treatment of psychiatric disorders. Comprehensive care requires dedicated specialists for both individual organ systems and the unique needs of different human populations. To review the map, for the skin, a dermatologist; the heart, a cardiologist; the brain and nerves, a neurologist; lungs, a pulmonologist; the digestive system, a gastroenterologist; kidneys require a nephrologist; and the urinary tract, a urologist; hormones, an endocrinologist; bones and joints, an orthopedist; the eyes, an ophthalmologist; ear, nose, and throat, an ENT; children, a pediatrician; pregnancy, an OB-GYN; and for mental health, a psychiatrist. Different physiological problems require different, highly trained experts. Knowing which doctor specializes in which system helps you navigate the hospital with clarity. This overview is for educational purposes. If you have a health concern, consult a qualified healthcare professional for a proper diagnosis and treatment plan. Understanding this ecosystem makes a complex hospital directory navigable. In Part 2, we will look at the specialists who treat blood disorders, infections, autoimmune diseases, and cancer.